Hey everybody, it's Dr. Eric Nepute. Hope we're having an amazing day wherever in the world you are. Hope you're well, hope you're happy, hope you're blessed. Look, I'm excited to be with you today. You know, this is PEPTalk, and PEPTalk is all about pepping you up. It's all about giving a little pep in your step. It's about educating you and telling you, your family, and loved ones what you can do to improve your health, your wealth, and your life. Look, those of you that know me, you know I'm a physician. I've been practicing now for over 20 years. I've helped tens of thousands of doctors across the globe, trained them, helped them educate and help more patients. And one of the biggest things that I get, that I just want to take a couple moments and just do a little fireside chat with you, is about the problem with our healthcare system. You know, right now, our healthcare system is neither healthy nor do they care. I know many of you have experienced this in your unfortunate experiences with the healthcare system. I just had a patient of mine that I spoke to yesterday. I hadn't talked to him in years, and he reached out to me last night and told me about this horrible, tragic issue that he had secondary to a respiratory infection. He went to 3 different hospitals. Nobody could help him. He just got out of the hospital and already got his medical bills and over $100,000 in medical bills that he owes, and his insurance is only paying a fraction of it, and he's not any better. How many of you can relate to that? What if there was a system out there that was better? What if there was a system out there that could help you find the root cause of your problem? What if there was a system out there that actually doctors and nurses and healthcare practitioners actually cared about you and they actually wanted to teach you about your health? I'm going to talk to you today about our failed healthcare system. And I'm going to tell you another thing I want you to think about. I want you to remember this. If our healthcare system is too big to fail, which is what I hear all the time, the answer is to create a new one. And we're part of that revolution. And we know the only way you can free your body is to first free your mind. And you got to understand what the problems are before you can understand the solution. So we're going to dig in deep into what is wrong with the United States and Western medicine's healthcare system today. So here we go, folks. I don't always read from notes, but today I am because I don't want to miss a thing. So let's dig into this thing. Did you know that annually, we spend $5 trillion per year on our healthcare system in the United States? $5 trillion. I mean, think about that. And by the way, you and I would be okay with that if that $5 trillion got us the best results and we were the healthiest country on the planet, but we're not. If you look at the top 100 industrialized countries on the planet, and I bet most of you probably couldn't even name 100 industrialized countries. But if you take the top 100 industrialized countries and you put the U.S. in that 100, and you took the total of all the money spent on healthcare with the 99 other countries that are out there, the U.S. still spends more. And again, we would be okay with that if we had the highest health rate and we were the happiest and we were the fittest and we spent but we're not. We're in the lower third of that. And in some cases, like infant mortality, we're way at the bottom. And did you know that it's been reported, even by the United States government, that $2.5 trillion, 50% of that money that's spent on our supposed healthcare is an absolute waste. And it's blown on literally administrative paperwork that does not move the dial. Literally, that money could get lit on fire and it doesn't improve the outcomes that you and your family get when it comes to Western medicine. I mean, think about that for a minute. And by the way, did you also know that out of that $5 trillion a year, that 250 billion with a B, let me say that again, 250 billion of that money goes back to kickbacks and paybacks to the insurance companies, doctors groups, and other lobbyist organizations. That's a massive system that, by the way, is broken and it's corrupt. And I want to dig into that, but I want you to understand, you can't understand where we're at or you can't understand where we're going until you understand where we've been. Now, do you know how healthcare started? Like this modern era of healthcare that started in the United States of America? How many of you have ever heard of a guy by the name of Andrew Carnegie or John D. Rockefeller? You heard of those guys? You know, tycoons of their time, right? These guys are the turn of the centuries. These are the oil and the railroad and the steel industry, right? Those are the guys, the same trillionaires back then, right? Did you know that they were the ones that started the first pharmaceutical company? That's right, in the United States. Did you know that? And they actually hired a guy by the name of Flexner. And this Flexner actually went around. He went around to all the medical schools and chiropractic schools and went to all the universities and all the acupuncture schools and all these places and said, look, if you'll join our ranks, if you'll do what we ask you to do and you promote our drugs, because that's what Rockefeller and Carnegie wanted to do, that they'll promote them and elevate them. Because, and by the way, we all know this, especially since 2020, we know whoever controls the megaphone or the media controls the message. And folks, that's what Carnegie and Rockefeller did. They hired this Flexner to go around and go to these colleges and say, if you will promote our stuff, sell our drugs, pimp our medicine out to your patients, then we'll pay you good money. We'll elevate you in the societal ranks that are out there, and we'll make sure that your competition is destroyed. And by the way, if you don't join our ranks, we're going to destroy you. So Flexner was sent to the medical field, and the medical doctors and the leaders of the medical world at that time said, okay, we'll join your ranks. They're going to build us the best hospitals. They're going to promote us in the media. They're going to lobby so we have the best laws, that we make the most money. As long as we sell your drugs, okay, we're in. So they sold themselves out. The Hippocratic Oath of first do no harm got thrown right out the window with that deal. And then Flexner went to another group of doctors who were primary care doctors at the turn of the century called osteopaths. They went to the Still family. Dr. Still was the creator of osteopathy in America. And they said, look, if you don't join our ranks, then we're going to destroy you. If you don't teach just like the medical doctors do, if you don't promote the drugs just like we ask you to promote, then we're going to destroy you guys as well. Because at the time, osteopaths promoted nutrition, lifestyle changes like eating well and exercising and sleeping well. What a novel idea to get someone healthy. And they manipulated the spine and muscles. And that's how they got folks healthy. Well, they were intimidated by Flexner, who said that he was going to destroy that profession from the inside out and from the government in. And so they said, okay, we'll do exactly what you do. And now to this day, you can't tell the difference between a medical doctor and an osteopath. They're trained the same, even though they're massively different at the roots of what they originally set out to do. Then they went to these other groups like chiropractors. They went to a family called the Palmer family. D.D. Palmer and B.J. Palmer were the founders of what's known as American chiropractic, modern chiropractic in this world. And they went to the chiropractic world and said, hey, we want you to promote our drugs. We want you to sell our stuff. And if you do, we'll give you all the same things we're giving the osteopaths and we're giving the medical doctors. If you don't, we're going to destroy you. And just like a bunch of good chiropractors, a bunch of rugged individualists, they thumbed their nose and said, we're not doing that. And so that's when the American Academy of Medicine started something called the Committee of Quackery. Have you heard of that before? You ever heard of somebody called a quack? Did you know that that's propaganda? Like, that's literally propaganda. That was the American Medical Association, which, by the way, is the lobbyist group for doctors that are out there. And by the way, just so you know, less than 12%, let me say that again, less than 12% of practicing doctors today have a membership in the American Medical Association. And so the AMA at the time started this thing called the Committee on Quackery. They went after chiropractors and they went after naturopathy practitioners and acupuncturists and herbalists and nutritionalists and Ayurvedic healers and all these healers that have been around since the turn of the century. Every culture has their own healing story to it, right? Every culture, Native American culture, Celtic healing, all these. And they called them all quacks. That's why you hear that. That's where that term came from. And it's absolutely insane. And still to this day, that propaganda is still pushed, even though it's illegal to do that now. Did you know that in the 1970s, there was a lawsuit called the Wilkes trial? And the Wilkes trial actually happened in the great state of Missouri, which I live in. And in Missouri, Chester Wilkes sued the American Academy of Medicine, and they won. And they won because it's illegal to call a doctor a quack. It's illegal to go after another profession. Like, why don't you just stay in your own lane and take care of your own people? The reason why they have to do that is the same reason why Flexner and Carnegie and Rockefeller actually went after other professions in the first place. It's because they wanted to corner the market. Like, you know, we live in America. It's a capitalist society. The free market should determine what a person does with their money, their body, their health, and etc. Not a corporation, right? Well, that's not what big medicine thinks. Big medicine is trying to control you through propaganda. And by the way, if the last 4 or 5 years since 2020 hasn't taught you that, I don't know what rock you've been living under. But even more, there's even more to the story than that. Did you know that to this day, in the 1960s, insurance started, right? You know your insurance companies, Blue Cross Blue Shield, Cigna, Aetna, even Medicare. And people say, oh, insurance is amazing. Insurance covers therapies and does all these things. Folks, that's where that $2.5 trillion of wasted spending goes towards. What if we lived in a society where you could have access to affordable precision testing? What if you could have access to affordable precision treatments as well? What if you could have that? That does exist, but they don't want you to know that. What if you could actually have doctors help you find the root cause of their problems and not just treating their symptoms? That does exist to this day, but they don't want you to know that. Why? Because it takes money out of their pocket. We need more people less sick. Wouldn't you agree? I want you to understand it's way easier to prevent illness than it is to treat a disease once you have it. And by the way, let's talk about the words prevent, treat, mitigate, those kinds of words, or even the C word, cure. Oh, you can't use the word cure. Did you know that? Did you know that those 4 words, prevent, treat, mitigate, and cure, those are words that are owned by the pharmaceutical industry. They're owned by the lobbyists. The lobbyists went and petitioned so that you can't say the word cure. You can't say the word treat. You can't say the word prevent. Folks, during COVID, I personally, as a physician, we saw over 11,000 patients in all of our practices that were positive for COVID-19, and not one person died. And we were making prescriptions for things like lifestyle changes and eating well and taking vitamins and nutrients. And we used the big scary word like ivermectin and vitamin C and D and zinc. And the government sued us for $508 billion. Let me say that again. $508 billion we were sued for. Why? Because the same thing that they were doing then with Rockefeller and Carnegie, they're doing again today. It's the same playbook, folks. It's just a different name. And the insurance companies now dictate the level of health and care that you receive as an individual. And that's not okay. That's not okay. Did you know that your insurance that you have, that you pay for, most people right now are paying thousands of dollars a month for health insurance premiums. I know that you're in that same boat. But when you now go to your doctor to use your insurance, most people have a high deductible, $2,500 or $3,500 annually for a deductible for themselves. Their family's twice as much. That means when you go to the doctor, you still have to use that $2,500 or $3,500 out of pocket before you can actually, have any coverage or anything paid for. You don't have insurance. You're part of a scam. You want to talk about a true Ponzi scheme? That's a true Ponzi scheme. Folks, I've been in practice over 2 decades now. Literally, I've seen hundreds of thousands of patients in all my clinics. And I will tell you, the insurance companies would much rather pay for a $40,000 to $50,000 surgery, which, by the way, has massive amounts of failure. And most people get hooked up on opioids and painkillers the rest of their life after the fact of this surgery, which the long-term effects are not positive of the surgery or those drugs, than to pay for, $2,000 to $3,000 worth of physical therapy and chiropractic that will really fix the problem in the first place. It's insanity. And folks, just like Einstein said, the definition of insanity is doing the same thing again and again and again and expecting a different result. Folks, it's time to stop the insanity. But unless you understand where we came from, you can't understand where you are and where we're going. And what if there was a parallel system that's out there? What if there was a parallel system that's out there that could help you find the root cause of your problem, and you wouldn't have to go through the horrible system and not get the treatment that you need and deserve and have to pay exorbitant amounts? I told you about my patient, $100,000 for being in 3 different hospitals for 2 weeks. This guy was in the hospital for a respiratory infection that they still haven't been able to resolve. And all he is now is more confused and $100,000 in debt. It's an absolute joke. And I'm telling you, you do not have to participate anymore. So let's dig a little deeper into some of the messes that are in our current healthcare system that you need to be aware of. And by the way, I know this resonates with you. I know that you feel this. I know that you've experienced what I'm talking about. So let's go through my top 20 reasons that the United States and Western medicine healthcare system has failed us. So number 1, We have a massive high infant mortality rate. Did you know that? Did you know that despite spending more on healthcare per capita than any other country out there, we have the highest rate of infant mortality amongst developed nations? I mean, that is an indication of a systemic failure on a level that we can't even imagine. Your babies are at risk more in America than any other developed country on the planet. Are you okay with that? Because I'm not. And what about the fact that chronic disease in children has risen over the last 30 years by 60%. 60%. Let me say that again. Chronic disease in children has risen by 60% over the last 30 years. That is crazy. So why don't we take a look at the system that leads to that? Not just the healthcare system, but the food system, the water system, the education system. There's a lot that goes into this. And we're going to unpack all those things. That's what PEPTalk's all about. We're all about education, inspiration, motivation, and giving you action steps that you can take to help yourself. But you have to know where you're at and where we're at before you can take a step into a different direction. By the way, what I'm telling you is completely factual. This is common sense, but unfortunately, we live in a society where common sense, folks, it ain't that common. Number 2 on my list, the lack of root cause treatment. Our healthcare system focuses on managing your disease. Let me say that again. They focus on managing your disease. Does anybody ever remember, you guys know Chris Rock? You know Chris Rock, the famous stand-up comedian and actor? Chris Rock's amazing. Chris Rock used to do a skit, and he would talk about, ain't no money in the cure. Ain't no money in the cure. Nobody wants to cure things because there's no money in that. The money is managing your disease. For example, you ever heard of something called type 2 diabetes? Type 2 diabetes, by the way, is really 2 problems. It's a fat metabolism problem where you're not metabolizing fat properly. And number 2, it's overconsumption of carbohydrate syndrome. It's so easy to fix. We have a program that we do in our practices, and we've created with doctors all across the globe that has a 90+% reversal rate with type 2 diabetes. Without drugs, without surgery, it can be done. Did you know that the American Medical Association, the American Diabetic Association, has a 2% success rate in reversing type 2 diabetes? That is laughable. If you got a 2% on any of your grades or tests or classes or driver's test or whatever in your life, what would happen? You would fail miserably and nobody would ever allow you to go to the next class or have that certification. But yet, the American Diabetic Council and the American Diabetic Society still promotes medications that haven't been proven to be beneficial long-term, and they're telling you diets that are just absolutely asinine. We're going to help you. That's what PEPTalk is all about. We're going to help you with a roadmap for that. By the way, not just with diabetes. I have a really good friend of mine. Let me tell you the story. I have a friend of mine. He's a very famous doctor. We'll have him on the program sometime soon, I'm sure. But he's a classically trained medical doctor, and he's also he's a researcher, PhD. And at a very prestigious university that has massive funding to do research on lots of things like cancer, he actually found a vitamin A extract. They took an extract out of vitamin A and are able to literally cure certain types of cancers with this vitamin A extract. And when he presented his findings to the review board at his university to go and take this to the next level, to get it approved and funded and taken to the world, he was so excited that his data and research proved this clinically, that they extracted this molecule out of vitamin A and literally cured certain types of cancers. Do you know what he told me came out of the mouth of the administrators of the university? They literally said, what would happen if we cured cancer to our economy? What would happen to our economy if cancer was cured? My friend said that he resigned on the spot and said, please remember that the next time you or a loved one gets cancer. I mean, think about that, folks. I was just talking to some congressmen recently about this thing called Operation Moonshot. Operation Moonshot is the current administration's plan to cure cancer. And I said, it's laughable. And they said, why is that? I said, it's laughable because there are over 1,000 chemicals allowed in our food supply to this day by the FDA that are known carcinogens and hormone and endocrine disruptors, but we're going to try to cure cancer? The cause is the cure, folks. If we eat well, think well, breathe well, sleep well, We will be well. But that's not the way that the system that was started by Rockefeller, Carnegie, and Flexner is to this day. Barons started it, and barons are still running it. Number 3, iatrogenic death. Did you know, if you go right now and you Google, what are the top 3 causes of death in America? And what are the top 5 causes of death globally in any country? Typically, number 1 is heart disease. Now, if you go to Japan, it's number 2. In the US, number 2 in most other Western worlds is cancer. So it's heart disease and cancer. Do you know what number 3 is? Number 3 is iatrogenic death. Death from medicine. Now, it's been reported that about 650,000 Americans die every year from heart disease. It's been reported that about 550,000 Americans die every year from cancer. It's been reported by Dr. Gary Knoll, MD, PhD, in his work, Death by Medicine, that some 900,000 people a year die in the U.S. alone from properly prescribed drugs, from drug interactions that kill people, from infections that are and hospital errors that happen. So even though it's labeled as the 3rd leading cause of death, most experts say it's number 1. I'll let you be the cause of that. But the system that we're spending $5 trillion a year is the top 3 leading cause of death in America. That's insane. Wouldn't you agree with that? But I bet you didn't know that. See, this is what frustrates me. Knowledge is power, right? No, it's not. It's the application of that knowledge, which is called wisdom, that's really powerful. So here's number 4. We have an inefficient system. I told you this. We spend $5 trillion a year. 2.5 of that is completely wasted. Give me that 2.5 trillion. I'll do something good with it. I promise. And y'all will be eating well, and we'll solve homelessness, and we'll just have a big dang party. How about that? Let me be in charge of it. We'll fix all these problems. I get a little frustrated because, man, this is common sense to me, but most people don't know that this is the way it is. What about number 5, lack of communication between providers? This is a big issue. What does that mean? See, in today's world, medicine is compartmentalized. Do you remember when you had children and you got that little ball that has all those shapes and the kid has to take the round shape, put it in the round hole, the star, and put it in there? That's what healthcare is. If you go to a doctor and you're a little circle and you don't fit in their circle hole, they punt you to the next doctor. If you don't fit in that circle, they punt you to the next doctor. If you don't fit in that one, they tell you you're crazy and they give you some crazy pills. Because nowadays, medicine is so compartmentalized. These doctors should know how the human body works. Like, my father's a mechanic, and he can tell you how an engine works. Not just the carburetor. He doesn't specialize in just the carburetor or spark plugs or tires or lug nuts. He knows how the whole damn machine works. That's what a doctor should do. But you don't understand. It's so compartmentalized in medicine that even if you're an orthopedic surgeon, you might only be a shoulder specialist or an elbow specialist. Like, that's how crazy it is. You go to your cardiologist and they have no clue that your gut could be causing heart issues. And they're not communicating. And your pharmacist, who's supposed to be the referee middleman of all the drugs you're prescribed by all your specialists, which is absolutely insane. The average American is on 7 medications, which, by the way, we know that every medication has side effects. Look at the end of every commercial on television. But did you know that never, ever, ever in the history of the world have we combined drugs together to study them to see what the compounding effect is? That's crazy. But yet people are just popping pills like it's nobody's business. More drugs, more surgery, more pills does not fix the cause. It is part of the problem. Number 6, the pharmaceutical industry is profiteering on a level that you can't even imagine. By the way, the pharmaceutical industry, for example, look at during 2020 to 2024. There's a little known company called Moderna. Moderna is a pharmaceutical company. In 2020, they were worth about $100,000. Now to this day, they're worth about $120 billion. How is that possible? It's insane what's happening. Your drug shouldn't cost you hundreds of dollars a month, even after your insurance. It's crazy. And the administrative cost. Again, 50%. This is number 7, administrative cost. 50% of all of healthcare expenses are administrative. Makes no sense. Failed medications and overdoses. This is one of the leading causes of death in America right now. People get addicted to drugs because a doctor puts them on a painkiller for their knee. It's called an opioid. and then they get off that opioid, which, by the way, they should wean off, not just cold turkey like doctors do, and now they go and buy fentanyl. And we know what's happening with fentanyl coming across the border. It's killing people, young people. Soccer moms are more addicted to painkillers and fentanyl than people that you would think you see on television that are, strung out, drugged out. Number 9, what about the inefficiency in the FDA system? Did you know the FDA that approves your drugs, they do not have independent scientists that go out and verify the studies that were given? Like if your drug company did a study and said, this drug is safe, we did it by a third-party study and gave it to the FDA. The FDA paid for that study to say what it needed to say. So it's not as protective as you would think. And boy, I'm telling you from personal experience, the FDA, the federal government, a lot of these folks kind of remind me a lot of the movie The Wizard of Oz. You've seen this before? Remember the scene in The Wizard of Oz where Dorothy and Toto and the Tin Man come back and they bring the broom back after they defeated the witch. They won their conquest and now they can go back to Kansas again. And then Toto goes and pulls back the curtain and there's some crazy old man pulling the levers. That's our healthcare system. There ain't nobody driving the bus. That's why it's not about healthcare. It's about self-care. I want you to understand that. The new wellness is self-care. You have to be your own advocate. You have to know the truth. And that truth will set you free if you apply it to your life. Number 10, insurance companies are in control. I already hammered that hardcore. Your insurance companies dictate the level of health and care that you get. As a practicing physician, if you bring your insurance card to me and I treat you as a patient, I have to justify to a doctor who's never seen you in their entire life, who gets bonused off of you not getting payment for, or me not getting payment for the care that you get. And I have to justify to this dillweed, and I'm being Dr. Dillweed. I have to justify to this guy that this is okay for them to do. It's crazy. Number 11, the massive amount of healthcare cost is insane. Let me give you an example. In our offices, we do a lot of regenerative medicine treatments. We do a lot of exosomes, stem cells, platelet-rich plasma injections. We're going to teach you about that. You do that same injection in an office like mine, you get maybe $100, $150 for a reimbursement on it. You do that same injection in a surgical center or a hospital, it's $10,000 per treatment for the same treatment and the same outcome. There's so many stories like that, it's not even funny. Number 12, unnecessary procedures and testing. This happens all the time. I cannot tell you how crazy this is. So many overprescriptions of test and test and test that does not change the care plan. Most doctors are ordering tests to cover their butt and to rack up your bill. Number 13, chronic disease management. I told you, they manage your disease. They don't treat the root cause. It's been said that most diseases are caused by mineral deficiencies, toxicities, and the lack of not sleeping well, eating well, moving well, thinking well, and breathing well. But when's the last time your doctor ever assessed any of those things? They don't. They just give you a drug, a potion, a lotion, or a surgery, and hopefully that fixes your problem. It doesn't. The next one, lack of preventative care. Like, you've heard that phrase, an ounce of prevention is worth a ton of a cure. Well, that's true, but only if you apply it. And the establishment that's out there now doesn't do that. They manage your disease. Prevention is the key. Number 15, access to care. Millions and millions of Americans lack access to essential, true healthcare, which I call root cause care. Number 16, mental health services. We're not treating the root cause of mental health. We're going to do segments on this on our Pep Talk, guys. But I'm telling you, the research and data shows deficiencies, toxicities, and problems with the gut microbiome contribute more to mental illness than any other thing that's out there. Healthy gut has a healthy brain. Number 17, health disparities. This is a big one, man. This is whenever people, because of their social, economical, their race, their religion, their creed, their background, they don't have access that they deserve. You shouldn't, because of where you live. This is America. This is the greatest country on the planet. You should have access to everything that you need and deserve, and it should be affordable. Number 18, pharmaceutical advertising. We're the only country on the planet. The United States of America is the only country on the planet now that allows the insurance companies and the pharmaceutical companies to directly market to you as a consumer on television. And inadequate support of alternative medicine. Folks, the studies are clear. that alternative medicine, chiropractic, acupuncture, naturopathic work, eating well, sleeping well, brain balance therapies, peptide therapies, natural hormone replacement, they work. They help people at the root cause of the problem. But you don't have access to it because you don't know, and they don't want you to know that. We're going to fix that here on Pep Talk. Number 19, inadequate support of adequate alternative care, like I said. And number 20, we have a massively aging population. And the science and data shows that through stem cells, peptides, bacterial work in the gut, and enzyme therapy, we can change the game for older folks. But when's the last time your doctor told you about that? Folks, listen, I'm going to wrap it up right now. I want you to go back and listen to this again and share this with your friends and family members. Folks, this is a game changer. If you'll get your head wrapped around where we came from with our healthcare, you get an idea of where you can go with your own self-care. And folks, until we meet again, I'm Dr. Eric Nepute. God bless you, God bless America, and God bless the world. I'll see you next time, and be well.